Hi, Miss Johnson. I'm Erica, and I'm your nurse today, and I'm coming to give you discharge instructions for you and for your new baby. As for you, as the postpartum mother, things that you need to look for is bleeding, as far as like lochia. After delivery, you'll have vaginal bleeding, and it's kind of like a heavy period at first, but then it lightens over a few days. It should change from red to pink slash brown, or it goes from yellow to white over to the next 2 to 6 weeks. And you can just use pads only so that it can flow easily, no tampons or douching. As far as for peri-care, you can use a peri bottle with warm water when you use the restroom to help relieve any pain that you may have. Also, pat dry from front to back when you're after you finish urinating. And also, you may use any ice packs or sit dabs to decrease any swelling or discomfort that you may have. And then change your pads frequently to just reduce any infections that could happen during this time. As far as breast care, if you're breastfeeding, we would like you to feed every 2 to 3 hours, or just on demand, like when she's like fussy, or she's probably hungry. Ensure that she's latching properly to prevent soreness. And also, you can air dry the nipples after feedings, and use a warm compress before feeding to help the breast milk flow easier. Also, afterwards, you could try cold packs on the nipples to help for any comfort, like periodically. If you aren't breastfeeding, wear a tight, supportive bra so that it can help dry up the breast milk. Also, avoid any nipple stimulation and any warm showers directly on the breast, just so you can help speed up the process as far as like drying up that milk. And you can use cold packs or take ibuprofen for any discomfort that you may have. As far as medications, only take the medication that's prescribed as directed, like from your doctor. If you are prescribed any stool softeners, you can take them daily to help with like constipation. If you are breastfeeding, just check with your provider before you take anything new, any new medications or any new supplements. And also, you can continue your prenatal vitamins, especially if you are breastfeeding. It definitely helps the baby. As far as activity, you can just make sure that you just start slow when you start doing more, as far as like exercising and moving around, and just move as tolerated. You can increase the load as you feel better, and also avoid any heavy lifting. And you don't want to really lift anything right now that's heavier than your newborn. Also, walking is encouraged so that you can increase circulation and everything. But you want to be easy as far as not doing any high intensity exercises until you're cleared by your provider. Also, avoid sexual intercourse, tampons, and douching for at least 6 weeks, or until your doctor says it's safe to do. As far as driving, do not drive until you feel that you can brake safely and react quickly. So if you're in pain, I would probably just, give it a rest for now. See if you can have someone either drive you around or do something like that. If you have a C-section, avoid driving for about 2 weeks, or until you're off the prescription medications, because that can cause drowsiness and tiredness, and you just want to make sure that you're alert and safe when you're on the road. For cesarean section, incision, and your episiotomy care, as far as the C-section incision, you want to just make sure that you keep the incision dry and clean. You want to shower normally, but you want to avoid being submerged in any baths or pools, just so you won't get any infections. You just want to pat the incision dry, and you don't want to rub it. You want to wear loose clothing just to avoid any like irritation or anything like that. Check daily for signs of like redness or warmth. If you have any oozing, any foul discharge, um, that could be signs of infection. So then you can contact your provider if anything like that happens. For any episiotomy or laceration care, you can use a bottle after your bathroom uses. Like when you're using the restroom, you can spray it so it can help with any discomfort. You can use ice packs for the first 24 hours, and then you can try a warm sitz bath to help with any discomfort. You can keep the area dry and clean just to cut down on any infections that may try to start. And then also, after you're not in so much pain, Kegel exercises can help with healing once you're comfortable enough and it's not causing you any pain. Signs and symptoms of an infection that you should call your provider if you experience is having a fever that's over 100.4 degrees Fahrenheit, any foul smelling lochia, redness or warmth or drainage from the incision, it being extremely painful, red, or any drainage that's from the incision, and also any burning or difficulty urinating. That's when you would like to call the provider. So then giving the childbirth can cause postpartum depression. And also, it's just important just to, know the signs. For the first 2 weeks, you can feel more emotional or more overwhelmed, but this is typically called the baby blues, which can kind of, be normal. But if you see that it persists longer than 2 weeks and you feel more sad and more anxiety or more irritable than you normally have been feeling, that's when you should reach out to your doctor. And just let them know like any symptoms that you may have, which is like having difficulty sleeping or any loss of interest in things that you would usually like enjoy doing, or just if you have any thoughts of harming yourself or the baby, that definitely requires immediate help. So that's when you would just call the proper resources as far as getting help immediately instead of just waiting on the doctor. And just noting is that help is available and you aren't alone, and then plenty of mothers or new caregivers experience this, so it's something that we want you to feel comfortable reaching out for help if needed. Also, when you should return to the doctor is usually a 6-week postpartum visit if you have a vaginal birth. With your cesarean birth, you may have an incision check at 1 or 2 weeks, but then you'll still have your 6-week visit. And then you can have earlier visits. It just depends if you have any complications in pregnancy or anything as far as they want to monitor with you. Symptoms that requires immediate attention, as far as like if you should go to the ER versus waiting on your primary doctor, is if you have any chest pain or any difficulty breathing. That's a reason to call 911 or go to the emergency department. Having severe abdominal pain, heavy bleeding, which is soaking more than 1 pad per hour, passing large clots that's probably larger than a golf ball, thoughts of harming yourself or the baby, signs of swelling, warmth, or pains in your calf, and a severe headache with vision changes. These are signs that you should definitely go to the ER or call 911. For newborn teaching, the first thing you want to go ahead and cover is if you're breastfeeding, you should feed every 2 to 3 hours. And since the baby's stomach is so small, you can just expect it to be short, frequent feedings in the first days until the baby's stomach starts to grow. Yeah. For normal daily output, you will expect by day 5 for your baby to have at least 6 wet diapers per day. Their stools will go from meconium, which is a blackish greenish, to green, and then to a yellow seedy color if your baby is breastfed. As far as for umbilical cord care, you want to keep the cord clean and dry. You don't want to give the baby any tub baths until it falls off. You want to make sure you fold the diaper below the cord, just to, to decrease any like rubbing or friction against that area. And also you want to use mild and fragrance-free soap for the baby. And don't use any lotions on the face. As far as for going over shaken baby syndrome, this can lead to brain damage in the baby or hemorrhage. So please, no one would never want to shake a baby that's crying. If you do find yourself being overwhelmed, please place the baby in a safe crib and take a short break. Also, know that you can reach out and have for any resources or any care support that you may have in your family to just try to help share that level of care if possible. As far as sleep safety and SIDS prevention, which is our sudden infant death, always place the baby on their back when they're asleep. Use a firm flat sheet on a flat surface, a firm flat sheet on a flat surface in a crib or a bassinet only. Do not do any like co-sleeping. Do not share the bed with the baby. And just make sure that the crib is free of any pillows, blankets, stuffed animals. And also avoid overheating the baby. Dress baby just in one layer more than you. You don't have to like have it the baby dressed in like so many like layers of clothes, because that can actually overheat them. As far as thermal regulation, the normal temperature for your baby is 97.7 to 100.4 degrees Fahrenheit. A few signs that the baby is too cold is cool skin, being lethargic, fussiness, and also a few signs that the baby is too warm is sweating, having flushed skin, and having rapid breathing. How you can assess the temperature is using a digital thermometer. The best methods for newborns is to use under their underarm, but just make sure it's actually tucked under there. It's not sticking out in the back, so you can get an accurate temperature. And also, if the temperature is over 100.4 degrees Fahrenheit, call the doctor immediately. This could mean something else, and is very important for the baby to get care if their temperature is ever like elevated in that way. Moving on to newborn jaundice, you need to watch for yellowing of the skin, and then if you can feed often when you feed, this helps remove bilirubin from their bodies. Also, call the doctor if any yellowing increases or the baby becomes very sleepy or feeds poorly. Things to look for is a high-pitched cry, being lethargic, trouble feeding could be signs that your baby has jaundice. As far as circumcision care, you just want to keep that area clean and dry, and then you want to change the bandage after each diaper change. And you're also able to put a thin layer of petroleum jelly on the top of the penis, just so it won't stick to the diaper. But after 24 hours, you're free to remove the bandage. Also, in that area while it's healing, you might notice any slight redness or yellow, and that's film, and that is normal. But if there is any active bleeding, any really swelling or foul odor, call the doctor, because that could be a sign of infection. And you just want to make sure that you clean that area with water, and that'll be fine. Just clean. You don't need to use soap and everything like that. As far as car seat safety, you want to make sure that the car seat is always rear facing, and the baby should be placed in the back seat. And make sure that the base is installed at the correct angle. And you want to make sure the straps are snug, and then at the chest clip is at the armpit level. And you just want to make sure that you double check, and they're usually that way until 2 years old. For infection control, you want to always wash your hands before touching the baby, and anybody else that comes in contact with the baby is to wash hands, sanitize. Keep the visitors and limited and avoid any sick people for you and your baby, just to keep you guys unsick and make sure that you're well. Keep the baby away from any crowds and any smoke exposure. Just, cut down on germs, and then just being exposed to smoke in general isn't good. As far as airway clearance, it's okay to use a bulb syringe and never use any cotton swabs inside of the baby nose. Things to look for to see if your baby is in respiratory distress is if you hear any grunting, nostril flaring, any retractions. These are signs to call 911. As far as symptoms to look for to see if your baby is having an infection, if they're feeding poorly, if they're vomiting, having diarrhea, they have few wet diapers, like they're not having that amount that we spoke about earlier. They have a rash or unusual skin color, if they're very irritable or have extremely sleepiness, and if they have any redness around the core or anything like that, or any signs of infection, that's when you would want to call the pediatrician. Symptoms that will require you to immediately go to the ER or call 911 for your baby is if they have a fever that is over 100.4 degrees Fahrenheit. If they have any trouble breathing, any grunting, any blue lips around the lip area, any seizures, any limpness or inability to wake, it's hard to wake them, having any persistent vomiting, which we call dehydrations, and signs of dehydration, which is no wet diapers within 8 hours. Usually the routine follow-up appointment is 1 to 2 days after discharge from the hospital, and then also ongoing you'll have usually that 1 to 2 weeks after that, and then monthly for your baby. Any questions? That's pretty much everything that we can have to go over. I'm going to send you home with a booklet and a few other supplies, but thank you very much. And that concludes my discharge teaching.